Dr. Lauren Dalvin, the Director of the Ocular Oncology Service at Mayo Clinic, Rochester, and I'm the corresponding author of an article entitled TNF-Alpha Inhibition and Other Immunosuppressants in the Development of Uveal and Cutaneous Melanoma. This will appear in Mayo Clinic Proceedings. I'd like to thank my co-authors, lead author Jenna Demento, a former Mayo medical student and current ophthalmology resident at California Pacific Medical Center, my mentor, Dr. Jose Pulido, the former director of the Ocular Oncology Service, Barbara Abbott from the Rochester Epidemiology Project, and David Hodge from Biostatistics. In this study, we found that exposure to immunosuppressive agents was associated with an increased risk of developing melanoma. Immunosuppressive agents are commonly used in medicine to treat autoimmune diseases such as lupus or rheumatoid arthritis, and these medicines have important benefits for our patients. However, recent studies have surfaced with concerns that these drugs might increase the risk of cancer. Specifically, a class of immunosuppressive medications known as tumor necrosis factor alpha inhibitors has been linked in some studies with development of melanoma. In this study, we used the Rochester Epidemiology Project database to explore the relationship between TNF-Alpha inhibitors and other immunosuppressants with the development of skin and eye melanoma in patients in Olmsted County. From an epidemiology standpoint, we found that over the years there's been an increased rate of melanoma, and we found that men and older patients are at further increased risk. Looking specifically at the relationship between immunosuppressive agents and the development of melanoma, we can look at Figure 2 from our paper. If we look at the chart at the top, we can see in the blue bars the percentage of patients with melanoma who have been exposed to the risk factors listed on the left, and we compare these to control patients with no melanoma in the green bars. We found overall that presence of an autoimmune condition does not increase the patient's risk for melanoma. We found also that exposure to tumor necrosis factor alpha inhibitors does not increase melanoma risk. However, exposure to immunosuppressive agents, either topically or systemically via mouth or IV, or exposure to high-dose corticosteroids do increase the risk for developing melanoma. And in fact, high-dose corticosteroids had the strongest association with melanoma, imparting a 3.3-fold increased risk. While more research is required to better understand the relationship between immunosuppressive agents and melanoma, we recommend that patients who are taking these drugs be vigilant for any new or changing skin lesions. We would also consider that they might see a dermatologist for a full-body skin examination, and we recommend annual dilated eye exams to rule out eye melanoma. We hope that laboratory medicine can help us better understand the cellular and molecular mechanisms and explain why immunosuppressants might cause or be related to melanoma development in the future. This can help us better refine our melanoma screening guidelines and understand how to most safely use these medications in our patients. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.